Hi, I'm Ray Schwetz here on ZPTV, and I'm here with Bob Day, who is our COO, Chief Operating Officer of Zwanger-Pesiri, and we're here to talk about why it's important to be screened, right?
Sounds good.
All right. So tell me a little bit about how, when I think of screening, I think of, you're going to get an x-ray.
Sure.
But a lot has changed over the years. So tell me a little bit about the evolution of screening at Zwanger-Pesiri.
Sure. So I think first let's start with the kind of the medical definition of screening, which is interesting. So I think that sometimes there's a misconception, and I think the best way to think of it is I refer back to mammography, which women are very used to. So there's mammography screening. So what does that mean? It means that yearly a woman will have a mammogram for screening. The screening component means that there's nothing wrong. Right? She doesn't have any lumps. She doesn't have anything wrong. There may not even be a family history.
Right.
The definition of screening is when you don't have a problem, we want to take a picture, which is what we do in radiology, and make sure you're not developing a problem before symptoms arrive.
Why is it important to be screened?
So screening, there's several reasons. There are certain types of cancers that are more prevalent that unfortunately can lay silent before they manifest themselves and start to show a problem. The problem with that is once the cancer rears its ugly head and we start to see that you have it, unfortunately a lot of times that can be too late. So as an example with mammography, once that lump gets big enough that you can feel it, it may mean that the cancer is starting to really progress to a point where it can cause a problem. Another area where we screen routinely can be for lung cancer.
Okay.
And a lot of times lung cancer, you may not realize you have lung cancer until maybe you develop a cough, or maybe the cough even starts to produce some blood as you cough. This is telling us that you have advanced cancer. So the beauty of, say, lung screening would mean that we would take a picture with the CAT scan of your lungs before you had any symptoms, before you had a cough, before anything was wrong. And we can find the cancer when it's at a stage where it's so small, we can detect it, but it hasn't caused a problem. So screening is important because we want to intervene before the cancer is advanced to a point where it can be hard to manage.
Gotcha.